Welcome to Global Med Talks, the podcast where we embark on a journey through the world of medicine and beyond. I'm your host Haider Ali, and I'm excited to be a guide as we explore a diverse range of topics, from sharing personal experiences to diving into medical stigmas, controversies, and beyond. In some episodes, I'll try to bring on guest speakers, I'll try to dissect hot button issues, and share practical tips for navigating both medical school and life. Hey everyone, welcome back to the show. I'm Haider, and today I'm joined once again by Dr. Adam for a powerful episode that every medical student needs to hear. We're diving deep into one of the most important but often overlooked aspects of your medical career: how to build a CV that actually stands out when you apply for your first doctor job. From research and teaching to clinical electives, volunteering, and even what kind of hobbies you should include, we're going to try to break it all down for you guys. Whether you're just starting out or polishing up before applying, this episode is packed with practical advice, insights, and real talk on what program directors are really looking for. So grab a notebook, tune in, and let's get into it. So, Dr. Adam, nice to have you again on this episode, man. Thank you so much for coming on. How have you been?
Thanks for inviting me. I've been all right. How about you?
Alhamdulillah, I've been good too, man. I'm just chilling. So, how's work been? I've heard there's been a lot of changes since we last talked.
I got accepted into residency and I'm going to be starting residency soon.
MashaAllah, that's so good, man. Honestly, I'm really proud of you, bro. And what residency is it that you're starting? Like,
So
in which specialty?
I'm starting in internal medicine.
Internal medicine. And is that what you wanted to get, or was it just something that you were given?
Yeah, it was my first choice.
Wow. Honestly, that's amazing to hear, bro. That's honestly really good news. So, which country are you in right now? Because I know you were in the UK before, and you've recently transferred to Canada, right?
Yeah.
And how's the transition been for you?
I mean, it's home for me, so, it's nice to come back. But we're going to have an episode dedicated specifically on Canadian advice, but we're going to try this episode to discuss just in general how to apply or how to build a CV for applying to residency or specialty training.
Yeah,
And this can
that's
be
true.
applicable. This can be applicable to either Canada, America, or the UK, or just in general.
Yeah, that's right, guys. So today we're just gonna keep it general and stay tuned. And hopefully, Dr. Adam is gonna come on again. Hopefully soon, and not after 6 months. But okay, so let's get into it, man. So the I was gonna break this podcast into down into like many different segments because, as you know, building a CV has a lot of different aspects to it. So we'll just go one by one. So the first one is what makes a CV stand out in medicine, just generally? Like, what do you think? Like, what are the key qualities, or what are the program directors or employers look for?
So, I mean, this question, it's hard to answer because every program looks at certain things more than others and they favor certain aspects of the CV more than others. But as a general rule of thumb, you want to be have a very well-rounded CV and try to avoid specific red flags or avoid having aspects of your CV empty because the people that you're competing against for a spot, everyone's going to have like their whole CV like maxed out every single aspect of it. Although like the different aspects of your CV may not be like incredible each individually, but at least having every one of it, every aspect of it filled out, and having something in each position will make it more well-rounded and stand out.
Yeah.
So I favor a more well-rounded approach of a CV.
Yeah, no, I agree, to be honest with you. I think having a more well-rounded approach, it sort of gives depth to the person as well. So it shows that you're not just like a narrow-minded individual. It shows that you have, what's the word?
That you're not just a doctor or a medical student. It shows that you are a real person outside of medicine as well, and that's what the programs are looking for. They're looking to hire real people rather than just robots or students.
Yeah, true, true. And it's not just about padding your CV with just like loads of different stuff. It's about building a story that reflects purpose, growth, and potential, and that's what employers actually look for. But yeah, you mentioned about red flags. What are the key red flags to avoid in general? Because we might go into detail about this afterwards.
I mean, an easy red flag that I can think of is, for example, having one section of your CV empty. For example, having the whole research section empty. That could be a red flag for certain programs because, for example, certain programs, if they value research and if you don't have anything at all there, that can make you much less of a competitive applicant.
Right.
Uh,
Okay. Okay.
so another red flag, of course, could be performing under average or way below on the exams, the board exams.
Right. Okay.
Another red flag would be lying on your CV or having dates or like misinformation that doesn't align with the rest of your application because they will be like looking at your application as a whole. It may be the same person who's looking at your CV will look at the rest of your application, and if they see two things that misalign, that could be a big red flag. So you definitely want to be as honest as you can on the CV and throughout your whole application.
Right, okay. So what you're saying is the first point that you mentioned was not to leave any gaps. So, I mean, the first tip to anyone that's listening is just try to fill in every single point as much as you can, even if it's like, mm, even if you think that the research aspect of your life is not that great, just try to do something and just try to have something that you can put there, and that will, you know, do some miracles for you. I mean, red flags aren't always what you leave in, but what you leave out in a way is what you've mentioned, right? Like the gaps, inconsistencies, or a lack of direction. So that's quite important, guys. So, how do you actually get into research? And have you gotten into research yourself? And how was it? And do you have any tips for publishing papers or case reports?
So I'll tell you what I believe is the easiest way for students to get into this stuff is by finding someone who is already in it and tag teaming with them. For example, if you're in the hospital ward and you can ask around your consultant or your senior doctors on the team what kind of research that they're in or if they have any active case reports or any active research that they're currently working on and ask them if you can join and help out in any way possible. That's what I believe is the easiest thing. Not just as well in the hospital setting, but even in the school setting, like in the university setting, if you ask your professors if any of them are doing research at the moment and if you could somehow help in any way.
Right, okay. So, in a way, curiosity is what the key is basically here.
Yeah, showing that you're curious and that you're interested, you know?
Hmm.
Because starting research from fresh is honestly a very difficult thing, especially for students.
Right, okay. Because me, Dr. Adam, I feel like I've never really gotten into research myself, but I do want to. And the doctors around me, I mean, the ones that I've asked anyway, they're not really into research either. They've either done it before or they're not really working on anything right now. But what confuses me a lot is, these research publications that people do, like how uh, could anyone do it, or do you have to have like certain skills to start?
I mean, anyone could do it, you just have to learn how. And from my personal experience, when I was able to join in on a case report, they already they have done a lot of the work, and I just asked them in any way could I join to help, and then they assigned me a role, and I just did my job as much as I could for them. I just did what they basically told me to because they are the ones who are leading because they're the experts. So as a student, you really just got to ask if you can help in any way, and whichever role they give you, try to do that and do your best at it. And you can learn online. There's a lot of online resources to help you out as well.
Right. Okay.
But anyone could really do research. It's not the actual work of it isn't difficult. It's more difficult like starting these things off fresh. That's why I say the best thing is to join someone who's already started one. Another thing that I'll say regarding to research slash publications is don't forget about the QI projects and the audits, because you can put those on your CV as well under either the research or the publication sections if you can get it done. It doesn't even need to be fully published, but just doing it and putting it on there will help out a lot. For my CV in particular, I had around 5 or more audits and QIPs that I've done throughout medical school and during my UK foundation program. And it
Oh,
doesn't have to be leading it as well. You could have joined in on one of those QIPs as well, and you could put that on there. And that's a really easy way to put some research slash plus or minus publications on your CV. So that's something that I think my application in particular stood out probably to others.
right. Okay.
And in the UK in particular, like in FY1 and FY2, you're required to get involved in a QIP each year. Actually, in the first year as an FY1, you have to just participate in a QIP, and then in FY2, you have to lead your own QIP. So by doing that, you're gonna have a really good advantage on your CV, and it's going to make you look good and stand out. And to be honest, there's so many QIPs going on in the hospitals that you work at. You could do any role, like you can help out in them in any way, and just by doing the little bit of help, you can add that onto your CV and make your CV stand out by how many QIPs you get involved in. Because QIPs, like I'm saying, are very common in the hospital. I always see different opportunities for QIPs, and you don't always necessarily have to do things relevant to your field of choice or like your specialty of interest. You could do any type of QIP or audit, and putting on your CV is still gonna put some weight to your CV and make you look good.
Yeah, sorry, just for the listeners that don't know what an audit or QIP is, can you just shed some light on what it actually is so people can understand what you're talking about?
So QIP is a quality improvement initiative or a quality improvement project, and it's first when you first do an audit by finding an issue of the hospital setting. For example, I did one in ACS, and my issue or problem was that my hospital wasn't prescribing enough statins, like full dose statins after people had ACS. So that was the issue. Their numbers weren't up to the standard. Then the next step you do is you create an initiative, for example, putting up posters throughout the hospital, and then you give it some time, and then you reassess, you re-audit, get the information again, and then you see, has your intervention made any difference, either positive or negative.
Right, okay.
So basically, it's you do an audit, and by auditing, you're checking, is there a problem? Then you put in an intervention. Then you reassess or re-audit and see, has your intervention made any positive or negative impact?
Right, okay. Now I can sort of, yeah, now that you've described it, I think now I can see why it stands out quite a lot on your CV. Because it doesn't just show that you're blindly following or doing what you're doing as a doctor or as a medical student. It shows that you take the initiative as well. And I think that's what people look for. When you're working as a doctor, you're not always going to have someone breathing down your neck telling you what to do. You need to sort of think for yourself sometimes, right? So it's a good thing to have audits, to be honest. Also, bro, I wanted to talk about leadership roles. How important is having a leadership role on your CV?
So I think that leadership is one of the most underrated areas in CVs or applications in general. It's something that people like don't really think of too often, but when programs are looking at applicants that have large leadership roles or a lot of leadership experience, I think that really makes them stand out. I would say even sometimes this can be a lot more valuable than other aspects of the CV, like research, for example, because leadership is such an important part of medicine.
Wait, so like, how do you get these leadership roles, and where can I find these leadership roles as a medical
So,
student?
so actually, in the leadership aspect, you can get experiences really anywhere. You can get quite creative with it. I think an easy one that a lot of people do, and what I did as well, is in university having the clubs or the societies and joining it and being on the committee of those. You know, being like a president or a co-president or any committee role on those societies or clubs. That's one of the easiest ways.
Right, okay. And what if it's not medicine related? Like, let's say you have like you're in charge of a tennis club or something, like completely just out of medical life and out of university life. Does that still count, and can I still put that on my CV?
Yes, you should definitely do so because like I said, it's an important quality of a doctor. You know, in medicine, you're always going to be requiring to have leadership because you're going to be leading a team a lot of the time, and you don't always learn leadership from the clinical perspective. You know, having outside experience actually really helps.
Yeah.
It helps you with like your relationships with your teammates and communicating with others. So I think this is a super big advantage, and as well, it makes you look really holistic and like a real person. You know, so I would actually like argue that that might even be more important than having a clinical leadership role. And
Yeah.
some programs view it incredibly highly.
Yeah, funny story. I was actually talking about this to my parents the other day as well because we were trying to look for some placements for my brother, and they wanted to get more clinical exposure. I mean, he's a pre-medical student right now, and they wanted him to get into a hospital just to, for some observerships. And bearing in mind, obviously, observerships are good. You get to know the system and you can ask questions to the doctors and everything. I'm not putting that to a side, but he's already done that like a couple of times. And I was sort of pushing my parents to get him to go to like Primark or something, or just go to a coffee shop, get some work done. And I was trying to push this idea of, it's good in a way because you can showcase like your other life skills as well, like communication with patients. You might be in charge of the coffee for like the cafe for a couple of hours or for the evening, and that actually is a lot more helpful than just sitting there observing the doctor or the and seeing how he talks to the patient, because once you do it firsthand, that's where you learn like a lot of the skills, especially leadership, or if it's applicable, communication, and a lot of other life skills as well. So it's a good thing you mentioned that.
Yeah, I agree. A lot of the medical attributes or characteristics that they want you to build can be difficult to be built in the hospital setting. So you really need to be well rounded, and you can practice these obtaining these skills in normal settings outside of the hospital. You know.
Yeah, yeah, absolutely, man, absolutely. Another thing I wanted to talk about was teaching. Yeah, how important is teaching, and do you have any teaching experience yourself that helped you for your CV?
So teaching is another really important place on the CV. I think almost every program will want you to have some teaching experience, and they value it because when you're a senior like resident or a senior doctor, a big aspect of your job is teaching the junior residents or the junior doctors. So it's an integral part of the doctor's role. So it is very important. So yeah, for me, actually, my CV, teaching was one of the biggest aspects of mine as well. I've done a lot of university teaching, so in the societies or clubs in university, I've done a lot of teaching towards medical students, mostly towards like the years below me. You could do those on Teams, like online, or you could do them in person. That's an easy way to gain teaching experience. You know, I had a bunch of those sessions in my CV.
Yeah, I joined a few of your teaching sessions as well, if you remember. You were really good, man. Honestly, I think that was one of the top qualities that you have. You're a really good teacher when it comes to teaching medicine.
Thanks. Another thing on the teaching experience as well, it doesn't have to just be medically related as well, because there's characteristics of being of the teaching role that you can gain
Mm.
through non-clinical areas as well. For example, on my CV, I also Well, I don't know if it was on my CV or when I was asked this in interviews. I would also mention that I was tutoring in high school, math and biology, which were two of my favorite subjects. And getting started from teaching at a younger age, I think that helped my love for teaching and helped grew the characteristics from a younger age.
So you sort of linked in what worked for you to get into medical school, and then you sort of used it again, and you said it better as well because now you got more teaching experience.
Yeah. And like I'm saying, it doesn't have to even be like academic related at all. You could say that you taught swimming, like you were a swimming or a basketball coach, and you could say, and in that you can actually link it to both leadership and teaching because let's say you're
True, yeah,
teaching
true.
them how to play basketball, and you're leading a group of students uh, in the basketball let's say camp or course or whatever, you know. So things like this you can put in two different aspects of your CV.
What about if you don't directly teach people is in a class setting or in a Teams meeting, but you sort of publish like small 5-minute podcasts and then you sort of talk about different topics? Does that count as teaching?
Yeah, of course. To be honest, I think uh, just as a general rule of thumb of the CV is that there's no hard or strict rules. You know, you could be as creative as you want. You know,
Right,
you
okay.
can, if you, like I'm saying, things don't even have to be clinical. If you did a podcast on teaching people how to cook, you could write that as a teaching experience as well. You know?
And what if the podcast didn't go viral or if it wasn't really successful? Can you still write about it or would they sort of find
Yeah, of
out
course.
and know? Okay. Interesting, interesting. So, guys, if you got any ideas for any teaching podcast, just get started and just put it on your CV. It's the best way to start.
This is just like some advice to help applications be well rounded. Of course, the better quality things you could do, the better. But any like simple thing you could do and just think of if you think it's a creative way to show these attributes that they're looking for, I would say just start it and get working on it. And even if you haven't even completed it, you could say that you're working on it. You know, for example, if you were lacking in research and you wanted to like write, if your application was lacking in research, you can you can get started on some research, like a research project, and then write in your CV that it's still in progress. But that is still better than nothing. You know, having something in progress is better than having it empty.
Yeah, true. Right, so the next thing on the list is volunteering. I mean, obviously, self-explanatory volunteering shows you have good character, it shows initiative. But what are your thoughts about volunteering?
I think volunteering is another area for you to demonstrate your attributes or characteristics that they're looking for. For example, if you want to show that you're selfless, you could do volunteering in things such as working at the homeless shelter or helping disabled individuals somehow. You know, all these things just make your application look incredible. And it doesn't have to be long-term volunteering either. You could do just a couple sessions here and there. Obviously, long-term volunteering is the best, but if you don't have that, at least doing short-term volunteerings will really help as well.
Yeah, true. So it's not really about logging hours, it's more about making an impact and showing that you can have an impact, and even if it's done quietly.
Yeah, of
So,
course. And another thing I would say as well is you can put a lot of different types of volunteering as well to show that you are even well-rounded in your volunteering, you know? I had a bunch of different types of volunteering and all of that makes you as well look good on your application.
what do you mean by all rounded volunteering?
What I mean by that is you can have volunteering in the hospital, for example, or in clinical settings as well. You can have things for humanitarian support, like helping at the homeless shelter, for example, or you can even have more other programs that you volunteered for, such as, basketball sessions for the youth. You know, that's something you could do. You know, any type of volunteering that you could think of in different aspects of life, you can
Right,
put that on.
okay. And
You
how
understand?
easy is it to find this volunteering? Is it quite hard? And do you need to know people for it, or could you just like easily find it on Google or the
It
internet?
helps if you know people who are volunteering, but you can always like ask around in different different settings. You know, in the hospital, you can ask if there's a way for you to volunteer, or if you like call your local homeless shelter and ask them if there's any chance you could do volunteering, or like thrift shops or anything.
Yeah, I mean, yeah, I was just gonna say because I was in search of like work experience, which is like funnily enough the next section of the thing. But while I was searching for work experience, I rang this hospital, and they were saying, "Oh, sadly, we don't do any work experiences at the moment." But then they did offer me an alternative of volunteering, and they said, "Oh, we have some charity services. You can go volunteer at a charity. You can help out with the coffee lady and give out coffee to the patients." So I mean, it is quite easy because people sort of refer you here and there, and it's a great thing to have. And I wouldn't really put it down at the bottom of the list. I would keep the volunteering quite high on your priority list because it does wonders, to be honest.
And it's an easy way to make your application stand out as well and look well rounded.
And it's fun as well. Like it's not stressful. It's fun. You feel good while doing it, and it's rewarding. So why not get volunteering, guys? Right. So the next topic was work experience. So in terms of like work experience and clinical electives, what exactly is the difference, just for the people listening?
So work experience, it can either be in the clinical setting. So for example, once you've finished and you've started your foundation training in the UK, that you can put that under your work experience. It could also be non-clinical things. So let's say before you even started medicine, you were working part-time at like a cafe or something, or at a sports club. You can write that in your work experience as well. Now, clinical electives, that's something very different. You usually do electives in medical school, in different specialties. And it's kind of like a placement, but it's just in your own, you get to pick your own specialty that you want to do it. And you get to sometimes get to pick the location. For example, you can have international electives as well.
Right. Okay. And how do you make the most out of your clinical electives instead of just standing there just watching the doctors do their stuff? Like, do you have any tips for the medical students so they can, gain some valuable experiences?
I mean, from the electives, you can gain a lot from it. For one, you could understand if you really like that specialty or not. And for two, it's a good way of demonstrating your interest in that specialty by doing an elective in it. For example, let's say you wanted to apply for urology, like residency training. If you do electives in urology, that would really help. It would show your interest in the specialty. And through it as well, you can, another thing you could do in your clinical electives is network. And by doing that, you could, for example, find more research opportunities or QIP or audit opportunities in those electives.
It's not about what you know, it's about who you know. And clinical electives helps you to know a lot more people, and that can sort of help you in the future as well.
Yeah, so I would say from electives, you're not necessarily doing it to just gain more like clinical knowledge in the specific specialty. Rather, you should go into it with the aim of to help your CV by showing interest of that specialty in your CV, and for helping to network with people and gain other opportunities such as research opportunities, QIP, or audit opportunities.
Yeah.
So you should view electives really as an opportunity for you.
Okay, so thank you for that. I mean, so the next sort of segment, I'm just going to combine it into two sort of things. What about like languages and hobbies and interests? Because people often overlook this because they feel like it's not really important. So, do you think it is important? Do you think people should mention their hobbies and interests? And how can they tailor this to, make it sound good for the employers?
So this again goes back to being a well-rounded applicant. They want a resident who's also a real human. They don't want a robot that just sits all day and studies, only does research. They want someone who actually has a life, because that means that they won't burn out. when they start residency because they have something that they'll go back to even in the most difficult days. So I think it's important for everyone to have a specific hobby or interest and make it obvious on their CV and as well in their interviews. This could
Yeah.
range from sports to some people like to do like singing or music or whatever or cooking. You know, it could be really anything. You could get quite creative with it as well.
Yeah, I mean, it was quite an important thing for even applying to medical school in the first place as well. Because when I was in the UK, there were a lot of people that had a lot of interests and hobbies on the side. Like I knew a few people who were part of a football team. I knew a few people who were part of the basketball team, who were good at painting, who were running. Like everyone like had their own sort of hobbies and interests. And to be honest, if you even look at the medical TV shows as well, um, whenever they have like a day off from the hospitals and stuff, every single like doctor or the actor who's playing the doctor role, they show that they have hobbies on the side as well, and I feel like that just demonstrates how important hobbies are in your medical career. What are your hobbies, by the way?
For me, I really like basketball. I really like ping pong. I like exploring nature and going hiking in the mountains.
You know that you got me into ping pong and basketball. I don't know if you remember. Well, you do remember, obviously. In first year, I was like really bad at ping pong, and you were like this master at ping pong. And every day we would practice just before lecture time, and we would play a few games of ping pong. And it came to a point where at the end of the second year, I would beat like half the cohort, and it was literally all because of you. And to be honest with you, my interest in basketball sort of came from you as well, to be honest. And then I sort of gradually grew as I went to Ukraine. And now, funnily enough, I play basketball like pretty much like every other day in Georgia. And it's one of the ways that I can just, let off some steam. So it's good.
Yeah, and that's exactly the point. By having a hobby or interest that you can play between classes or after work every other day, a really important thing because it allows you to relax and it helps fight against burnout.
Yeah.
That's something that residency programs really value. They really want you to be, they really want you to have a way to fight against the burnout and fight against the stress because residency and specialty training, it can get very stressful and it's a lot of hard work, so you really do need a hobby that you can stick to get your mind off the work and make you grounded and put your mind at ease after the hard shifts.
Yeah.
and
Absolutely,
and
man.
And in fact, as well, like that's a really common interview question that you'll get in your interviews. So you need to this area will help you in answering your burnout question as well.
Yeah. I feel like for the employers, balance is like a buzzword, isn't it? Like, because it's the foundation of just long term performance and well being. And I think that's quite important, and that's what they look for.
Yeah, and physician well-being and physician burnout, these are incredibly important things in real life and in interviews. So, by building your CV on these things, you're gonna be building your interview answers as well.
Burnout, I feel like it's so important. I might actually do another episode on it, I just thought of it now. So, guys, stay tuned. I'm going to do an episode about burnout. If you're listening, if you want to join in on the episode, let me know. So, just before we finish off, Dr. Adam, should refer to you as doctor now since you're a hardworking doctor. What do you wish that you knew earlier?
Something I wish I had done earlier was try to get involved in as many things as possible, even if they didn't seem clinically relevant. Because when I was younger, I thought that I had to be volunteering in like the hospital setting, or I could only do QI projects or research specifically in my field of interest. But that's not true. By having these things done in different settings, it can really help out when it comes to building your CV and becoming well-rounded. So getting started early and try to get involved in as many things as possible, even if they're not clinically relevant.
Yeah,
You know
I
what I
agree,
mean?
man. I agree. So yeah, basically just make sure you present yourself as a well-rounded person. Don't just be a bookworm. Don't just be a med student that just studies all the time. Have some skills. Have some transferable skills as well, and just make sure you tick every box. And even if it's not to perfection, just make sure you have something there, and that will greatly increase your chances of finding a job. So, thank you very much, Dr. Adam. Thank you for coming on, and surely I'll get you back on soon for some future episodes.
Thanks for having me.
No worries, man, no worries. That wraps up our episode on building a standout medical CV. Huge thanks to Dr. Adam for sharing his experience. Remember, your CV isn't just a list of achievements, it's your professional story. Start building it with intention, even if you feel like you're starting small, and just make sure you present yourself as a well-rounded individual. If you found this episode helpful, don't forget to share it with a fellow medical student and follow the podcast for more real conversations that support you on your journey to becoming a doctor. Until next time, peace out.